So let's now focus on the options available in the hormone duration part of the Radicals trial. Your doctor, in common with other experts throughout the world, is uncertain whether hormone treatment should be given to men having radiotherapy after surgery, and if so, for how long. That's why doctors want to do this study. Let's watch Dr. Stafforth explain the trial with a patient who is going to have radiotherapy treatment.
So my standard practice would be to give radiotherapy on its own. But in the trial setting, because we're looking to try to improve our cure rates and improve our control rates, and we know that hormone therapy is active, we're trialling two durations of hormonal therapy. One is for a 6-month period,
right,
and one is for a 2-year period.
Which is which? Oh, I see what you mean.
So
I'm sorry, I understand what you mean. Yes, so I could do it for 6 months, or I could do it for 2 years, as it were.
Yeah, and the way the trial works is that because I don't know if a longer duration of hormonal therapy is better, you're allocated by the trial centre.
So a random.
Yeah, it's a random process. So what happens is that doctors enter patients into the trial who they think are suitable, and as long as patients have read the information sheet and are happy with all the information, they agree to go into a pot of patients who are then allocated to either standard therapy, which is for me no hormonal therapy,
right,
or 6 months of hormone therapy, or 2 years of hormonal therapy. And then you follow the treatment course as set out in the trial, and then we follow your outcome. And we're looking at not just whether we cured more patients, which is, I think, probably some of your age, a very important feature, but also clearly the side effects you may have, and any effects the hormones may have had on your working life, your quality of life, your sexual quality of life. And that's clearly very important as well. Yeah. So the trial is trying to balance up the effects on the tumour with the effects on you as a man, so that in the long term we can inform future patients in your situation.
Let me summarise the main points from that again. When radiotherapy is used after surgery for prostate cancer, it can be given either with or without hormone treatment. The experts don't know for certain whether having hormone treatment is of benefit to patients, and that's why they're doing the study. They're also unsure whether hormone treatment should be given for 6 months or for 2 years. The Radicals trial will try and find out which approach is the better one. There are 3 options for you to consider. One is being randomised between radiotherapy alone, radiotherapy and 6 months hormone therapy, or radiotherapy and 2 years of hormone treatment. After careful discussion with your doctor, you might feel strongly that you want to have some hormone treatment with your radiotherapy. In this case, you'd have the option of being randomised between radiotherapy and 6 months of hormone treatment, or radiotherapy and 2 years of hormone treatment. Alternatively, if you and your doctor feel strongly that you don't need hormone treatment for as long as 2 years, there is the other option of being randomised between radiotherapy alone and radiotherapy and 6 months of hormone treatment. So what does being randomised mean? Well, if you decide to join the Radicals trial, you'll be asked to sign a consent form, and then the doctor or research nurse will phone the main study centre and give details about you and your condition. At the study centre, a computer randomly allocates numbers to patients. These numbers then are used to divide patients into one of the groups within the different options. Neither you nor your doctor will be able to choose which group you're put into. That is done by the process called randomisation. It might sound a rather strange way of deciding which treatment you're offered, but it is actually a safe and scientific way of ensuring that we have equal numbers of patients of different ages and state of health to make a fair comparison between groups. So what else would happen if you did decide to take part in the study? Your care would probably be very little different to that you'd have outside of the trial. You'll have clinical examinations including blood tests for PSA and be followed up at the hospital every 4 months for 2 years, every 6 months for 5 years, and then annually until 10 years have passed.